Davi Sabina, it's been a while. How have you been? Have you heard about Sienna 2025 in Dallas? It's going to be the biggest event of the year.
Oh, Pastor Martin, so good to see you. I've heard some buzz about it, but tell me more. What makes it so exciting?
Oh, where do I even begin? It's a 4-day celebration filled with culture, networking, and unforgettable experiences. Plus, they've made registration super easy.
Really? How do I sign up?
It's so simple. Just go to www.dallasaves.org. Again, www.dallasaves.org and pick your package. You can even add a $60 excursion to explore Dallas in style.
That sounds amazing. But what about hotel accommodations?
Oh, no worries. The convention registration is linked to the hotel reservation. When you register, just select if you need a hotel and the dates you will be staying.
Oh, that is so awesome. And I don't need 2 lanes?
Yes, you will get an email from the Sheraton DFW Hotel with your reservation details and a credit card authorization form to finalize it. And the best part, you won't be charged for your room until you check out.
Oh, this is really convenient. Anything else I should know?
Yes, as if the package wasn't already great, they just announced that everyone who registers now gets a complimentary buffet-style American breakfast at the hotel.
Oh, no way. That's such a great deal. I don't want to miss out. I'm registering right away before I forget.
That's the spirit. Let's lock in our spots and make Sienna 2025 unforgettable.
Hello, hello, hello. Another Saturday is here with us again. Welcome to the Health and Wellness Hub. We are on Sienna Media and on this our YouTube channel. So if this is your first time watching us or joining us, welcome, and please share and subscribe to our channel. Thank you for joining us. Today we're going to be talking about a very important topic regarding our health, colon cancer. Yes. Yes. Okay. So before we delve into that, as usual, our sister Davi Sarah is here to give us our motivational message for the day. So we'll go straight to our sister Davi Sarah, and I'm your host, Miss Dale. All right. Over to you, Davi Sarah.
Thank you very much, Miss Dale. Hello, everyone. For today's motivation, I just want to encourage somebody that everything is getting better. Everything is always getting better because that is how God is working things out for you. But the question is, do you believe that? Because there's a difference between wishing, hoping, believing, and trusting. So believing and trusting is on one side of the spectrum, and then hope and wishing is also on one side. And so I want you to carefully review what you are wishing for. And if what you are wishing for hasn't transferred over to you believing and totally trusting that God will do it for you, then excuse me, that is the reason for the delay. Yes. Why is it delaying? It is delaying because you still are in your wishful situation or hopeful circumstance. The wishes and the hope, they are good and they are the starting point, but we need to transition from there to hoping, to believing and trusting completely, totally, absolutely in the promises of God, in the power of God, in the ability of God to do what he has promised to do for us. Now, I want to give a little reference to what I'm trying to, say here. It's like wishing and hoping is on one frequency, like a radio station or even the TV channels. We flip through channel. Each channel has its own programs and its own activities ongoing. And so the wishing and the hoping is one frequency. Let's say 87.9. That's the frequency of the wishing and hoping. Now, after you've wished and hoped and asked for, you need to move from that frequency and meet with the things you are asking for on a different frequency, because the answer is definitely not going to be in the asking. It's a different frequency when you're asking, and how you feel when you're asking. And it's a different feeling when you are accepting and being grateful for what has been done for you. And so it's important to move from the hoping, the wishing, the asking into the trusting and the believing state. That is the state of gratitude, the state of appreciation, the state of believing and knowing that it is done. And so you don't worry anymore about it. You don't ask anymore about it. You are just grateful, knowing that if I don't have it right now, it's just a matter of time and it is coming. So those are two feelings. And so I just want to encourage you that evaluate yourself, see what you're feeling, and let that be an indicator to you, knowing that, okay, I'm in a right state to receive or I'm not. So please take note of how you're feeling and when you're asking, because these two different emotions or feelings will indicate to you that you are close to receiving that amazing and incredible breakthrough or answer or, response that you are asking God for. So please, let's move into believing and trusting totally in God, because Jesus said it is finished. And so whatever you've asked, it is done. It's a matter of moving into that frequency, that state, in order to meet with it or receive it. Thank you, and God bless you.
Thank you, David Sarah. Yes, we need to believe it. We need to believe whatever we utter with our mouth, or whatever we believe, we need to trust and hope that it is done. Thank you so much. Thank you so much for that. We're going to keep this in mind throughout the week, and we're going to try to practice it, and we'll see the good results. Yeah. Thank you, David Sarah. So before we go to our special guest today, Dr. Afenya, who is not new to this channel or to this TV network, we'll take a short commercial break, and then we'll be right back. Stay tuned.
Hey David, as-tu entendu parler de Siana 2025 à Dallas? Ce sera le plus grand événement de l'année.
J'en ai entendu parler, mais dis-moi davantage, Richard. Qu'est-ce qui le rend si extraordinaire?
Oh, par où commencer? C'est une célébration de 4 jours remplis de culture, de réseautage et d'expériences inoubliables. Et en plus, ils ont rendu l'inscription super facile.
Vraiment? Comment puis-je m'inscrire?
C'est simple. Il suffit d'aller sur www.dallasairways.org et de choisir ton forfait. Tu peux même ajouter une excursion à $60 pour explorer la belle ville de Dallas en style.
Ça a l'air génial. Mais qu'en est-il de l'hébergement à l'hôtel?
Pas de souci. L'inscription à la convention est liée à la réservation d'hôtel. Lorsque tu t'inscris, il te suffit de sélectionner si tu as besoin d'un hôtel et les dates de ton séjour.
Oh, très intéressant. Et je n'ai même pas besoin de 2 livres.
Pas du tout. Tu recevras un email du Sheraton DFW avec les détails de ta réservation et un formulaire d'autorisation de ta carte de crédit pour la finaliser. Et le meilleur, tu ne seras facturé pour ta chambre qu'au moment de ton départ.
C'est vraiment pratique. Y a-t-il autre chose que je devrais savoir?
Eh oui, comme si le forfait n'était pas déjà incroyable, ils viennent d'annoncer que tous ceux qui s'inscrivent maintenant bénéficieront d'un petit déjeuner américain, buffet et gratuit à l'hôtel.
Je n'en crois pas mes oreilles. C'est vraiment une offre spéciale. Je serai de la partie et je m'inscris.
Et voilà, réservons-nous maintenant, réservons nos places tout de suite et rendez-vous à Siana 2025. Ce sera inoubliable.
Welcome back. This is the Health and Wellness Show, and I am your regular host, Ms. Dale. So today we're going to be talking about colon cancer. Yes, it's one of the, I think the most common cancers that we've been hearing about. So today we have here Dr. Afenya, who is a nephrologist, is going to be talking to us about colon cancer. Dr. Afenya, welcome.
Thank you. So it's awesome to be back on this channel again. I remember the last time we talked about kidney disease. Today is going to be on colon cancer. The reason being, if there's anything I thought you should take from this talk, is that colon cancer is real and you should get screening for it. That's the number one thing. You should look for it and find out if you have it or not. So we're basically going to break down the talk into what is colon cancer. We first want to know what is colon cancer. Then we will look at what are the causes, what are some of the things that will cause colon cancer, and then what are the screening methods available for looking out for colon cancer if you have it. And the keynote is early detection. You want to pick it early enough. You want to find out where it is, pick it early enough before it spreads to other parts of the body. Then we're going to talk about signs and symptoms. I wish we don't even have anything like that, but unfortunately it will happen. But then if you have the signs and symptoms, then you can go and get checked up. But I want you to go way before. Get checked up, detect it early before you even have to have any signs and symptoms. And then if we talked about that, then we're going to look at, okay, what are the treatment options that are available for you should in case, you miss the opportunity to go get checked for it and find out if you have it or not. And then the last one will be prognosis. What are the prognostic factors? If you get diagnosed with it and they tell you you're in stage 4, what does that mean? If they tell you you're in stage 3, what does that mean? Stage 2, what is the meaning of that? So those are the things we're going to look at. So the first thing, what is colon cancer? Now let's just go through a brief anatomy of the what we call the GI tract, the gastrointestinal. So when you eat food, of course, you all know that goes from the mouth, it goes through the food gut, which is called the esophagus. From the esophagus, the food goes straight into your stomach. Then you go into the small intestine and then the large intestine. So the simple name for the large intestine is the colon. So you may hear people call colon cancer colorectal because the rectum is the terminal part or the last part of the colon. So sometimes people just refer to it as colorectal. People who have done a little bit of anatomy will know that you have the small intestine and then you have the large intestine. The large intestine, of course, is divided into 3 parts. We have what we call the ascending, the transverse column, and then the descending column. So cancer in any part of the colon is what we refer to as the colorectal cancer because the rectum is also involved. So that's the brief anatomy. So of course, you can have cancer in the small intestine, you can have cancer in the stomach, but these ones are not common, or they are not things that we can do a lot about because most of the time they are hidden. If you have symptoms, then we work hard to look for them. Why is colon cancer very, very important? Colon cancer is the number 2 cause of mortality in all. So if you take females and you take male, prostate cancer in male is very prevalent, highly prevalent, but breast cancer in women is also very common. But then apart from breast cancer and prostate cancer, colon cancer comes number 2 as the commonest cancer. And so that is why it is very, very important. Now, colon cancer is very common, not just because we are exposed to one particular kind of risk factor. Now, like all kinds of cancer, we haven't been able to tell exactly what the causes of cancer is. But we know that, for instance, if you take lung cancer, for instance, we know that there is a strong association with lung cancer with smoking. And the same vein, other cancers, we have strong association with what we call carcinogens, which, there are a lot of them, so chemical exposures and things. Colon cancer in particular, we have some association as well. So people with a high fat diet or low fiber diet have high risk of developing colon cancer. The other thing that we found out is called we call carcinogens in food, and some foods that we have carcinogens in it. So you realize that one way or the other, you see FDA come out and say, oh, this food product has carcinogen in it and it should be banned. So that's the association that we have with colon cancer. We still haven't been able to tell exactly what the causes of colon cancer, but we know that it's very, very common. Now, we're going to talk about the screening that is available for us. Now, there are several means by which we can tell if your likelihood of developing colon cancer is high. And one of them we call the fecal occult blood test or stool occult blood test. What that means is that occult just means that you're bleeding internally, but we are not able to pick it up. We can't tell where the bleeding is coming from, or you're not bleeding profusely because it's tiny amounts, so we call it occult. Now, if you have likelihood of developing a colon cancer, we send for this test, which is a screening test. The screening is looking for small amount of blood in your stool. If the test comes back positive, it does not mean that you have colon cancer. It just means that you're bleeding from somewhere, and one of the causes of that bleeding might be colon cancer. So that means that you have to go have more tests done to find out if you have colon cancer or not. So that is the stool occult blood test, or fecal occult blood test. The other screening that is available for us is what we hear, most of us, maybe we've heard about it on TV, is the Cologuard, which, they will send you some thing in the mail that they will be able to tell if you have colon cancer or not. But the most important of all this is colonoscopy. Colonoscopy is just a way of looking inside the colon to find out if you have colon cancer, 1, or 2, if you have other findings in the colon that can predispose you to developing colon cancer. So again, I'm sure there are people here who've had colonoscopy done, and it's one of the things that people dread a lot. But if there's anything that you want to take from this, please go and have your colonoscopy done. Are there questions came up?
No, not yet. I've asked
Okay,
our audience to send any questions. So whenever you're done, we'll just go back. We'll go to the questions.
Okay. If you have any question, they can send it to the chat, right?
Yes.
Okay, good. So what I was saying is the screening is very, very important, which is the colonoscopy. And what they'll do is there are two means by which, first of all, before you be able to look at the colon, which is called the mucosa, look at the layer very well. One, you have to make sure that the colon is clean, because you know stool is usually the stool will be in the colon, so you have to clean the colon. So that's what they call the prepping. There are two means by which we do that. One, they can give you a gallon, or what is called golightly, in a gallon, and you have to drink it overnight and then clean the colon. This process is very important because if you don't do what we call bowel prep very well, then the colon is impacted with stool, and your ability to see the entire layer and determine if you have risk factors or not is very low. You will not be able to see very well. So if your doctor asks you to do a bowel prep, take it serious, because that you don't want to do it twice. Your first one, you want to just make sure you drink it and get your colon well prepped before. And colonoscopy is just like looking inside the colon using a camera. So what it is that it's a tube, it's a long tube, which at the tip of the tube has a camera. So they push this tube down your rectum way into your colon, and look, remember I told you there are three parts of the colon, right? They are ascending, transverse, and descending. So you go right into the ascending, looking for any kind of thing, any evidence of colon cancer, one, or two, looking for what we call polyps. Polyps are some kind of precursors. They are, if you have a polyp, it doesn't necessarily mean that you have colon cancer, but some polyps can easily transform into colon cancer. And that's why if the doctor goes in and he sees a polyp, he's likely to take the polyp up so that you don't have the opportunity, or the polyp doesn't have opportunity of translating into colon cancer. So when are you qualified to go for a screening? Now, colon cancer is very rare in people under the age of 40. So people below 40, their likelihood of developing, it doesn't mean that people who are below 40, you don't have some instances where somebody will have, but it's not common. So for you to subject the entire population to screening below the age of 40, your chances of picking up colon cancer will not be much. Now, after the age of 50, it is very, very high that you might have colon cancer, or you have the risk factors for it. So long time ago, the age limit for screening for colon cancer was 50 and above. But in recent time, they've changed it to 45. So as soon as you're 45, your GP, your general practitioner, will send you to the specialist to go and have screening done for colon cancer. Now, apart from that, there are other people that colon cancer will run in the family. In that case, the screening will be done earlier than usual for that particular family. So for all of us, after the age of 45, we have to go and make sure that we have this screening colonoscopy done. Why is screening very important? Now, we as human, we can live without a large portion of our colon. Like if you take the colon away, we'll be fine, because we still have a large segment of the colon that we can depend on. But if you don't detect the cancer early enough, all cancers have tendency of spreading. So if you take the colon, for instance, the cancer can spread to what we refer to as lymph nodes or lymph glands in the body. They can also spread to any part of the body. They can spread to the bone. They can spread to any organ in your stomach. They can spread from the colon to the liver. The liver, they can spread to your lung. It can even spread to your brain. And so what you're trying to avoid is that if you catch it early enough, where it is early stages of colon cancer, then you can remove that portion of the colon with the entire cancer before it will have the ability to spread. Now, there are people that sometimes it will spread from the colon to the liver, and then they'll go and take part of the liver away, take part of the colon away, and they will be fine. But the best thing is catch it early before it spreads from the colon to other parts of the body. Now, so now that we talked about screening, let's, which I wish that we would all have done screening before it spread to a point where now it starts causing symptoms. So if it does, what are some of the signs and symptoms of colon cancer? One of the commonest is what we refer to as bowel changes. Bowel changes, meaning that your bowel movement, maybe you have 1 or 2 bowel movements a day, but now you're having either frequent bowel movement, or you're having constipation. So either presence of constipation or diarrhea, because the cancer is now present and it is irritating your bowel. And so either you're having diarrhea or you're having constipation. That's bowel changes. The other symptoms is feeling of incomplete. So you go and you think, oh, I want to go to number 2, but then you feel as if there's still something there. That is also a sign. The next one is if you see blood in your stool. Now, if you see blood in your stool, it doesn't always mean that you have colon cancer, because there are other causes of bleeding in the stool, which will be like if you have hemorrhoid, which is actually the commonest cause of bleeding in the stool. You could have maybe some kind of infection, or you could have a tear in your colon that is bleeding. You could have something we call diverticulitis and all that. So if you have any form of bleeding, it might be one of the signs and symptoms of colon cancer, but not always. But you want to go get checked for that. Now, some people would also present with other symptoms like weight loss, which is also very common, generalized weakness. Some people present first time with just anemia, and then they say, okay, you have anemia, now go and check, make sure that you're not bleeding internally, and now boom, they have been found to have colon cancer. So those are the signs and symptoms of colon cancer. Again, they may be broad, but you know, the commonest are the ones that I've mentioned before. So what are the treatments that are available for us should in case you have colon cancer? Now, if you have colon cancer, the treatments that are available for us, the main one is chemotherapy. Chemotherapy, cancer cells are just abnormal cells. So for us, for instance, whenever your skin, for instance, will be shedding off, right? The skin you have right now is not the one you were born with. Your skin has what we call the basal cell. They grow. You shed off a layer, and then the layer comes up. So that's how cells replace. So for instance, you may have situations where the cell is being replaced constantly. So during this replacement, if the replacement of the colon, that's the lining of the intestines, is being replaced by cells that now they are not stopping, they just keep growing and growing and growing, and they become abnormal. That's what we call the cancer cells. So the idea behind chemotherapy is to try and slow down that process of replication, producing more abnormal cells. But the reason why chemotherapy sometimes affects us a lot is that in an attempt to kill the cancer cells, when you're, using the chemotherapy also affects the normal cells. And so that's why people have like hair loss, because, you're trying to destroy the cancer cells, but then unfortunately the chemotherapy is toxic to the other cells as well. So that's one. The second one is surgery. Surgery, meaning that the reason why surgery may be the most important benefit you will have is that if you are able to remove all the cancer cell, then you don't need chemotherapy, because you took all the cells out of the body. And that is why screening for colon cancer is still very, very important, because when you find the cancer early enough, let's say stage 1, then you can take the whole colon out via surgery. So with that cancer would not spread to any part. Of course, if it's already spread to, for instance, the liver, you can take the cancer out from the colon, and then you go and take a portion of the liver away as well. So those are the two main means by which we treat colon cancer. And there are other options available. For instance, if it's already spread to the bone in your back, you can have radiation therapy and things like that. So those are the main ones available. So for me, I would take it that screening for colonoscopy, screening with colonoscopy is very, very important to find out if you have it, so we can treat it early with surgery.
Okay, no.
Any questions?
At this point, we'll just take a short commercial break, and then we have 2 questions. We can take that, and then you can continue with
okay, sure.
presentation. All right.
Thank
Thank
you.
you, viewers, for staying with us. Please don't go anywhere. Stay tuned.
Maximize your convention experience at Dallas 2025 by unlocking history and innovation that suits all ages. Join us for an unforgettable experience as we tour U.S. Currency Engraving Site and the Museum of Science and Technology, all at $60 per person. Make the most of your time in Dallas by visiting 2 of the most fascinating destinations in North Texas. Step behind the scenes and witness the intricate process of currency engraving, where history meets art. Explore how bills and coins are designed, engraved, and perfected by expert artisans. It's a rare opportunity to see the craftsmanship that goes into the money we use every day. Fort Worth is a cornerstone of America's financial legacy and is one of only 2 U.S. locations producing paper currency. Just around the corner, dive into the world of innovation and discovery at Fort Worth's Museum of Science and Technology. From hands-on exhibits to inspiring displays, the museum is a must-visit for curious minds of all ages. Don't miss out on this chance to explore both the artistry of currency and the wonders of science. Add the $60 tour to your registration package for a comprehensive convention experience. Register today.
Okay, welcome back, viewers. You're watching the Health and Wellness Hub, and we're talking about colon cancer today. Yes, and before we went, the advert was all about the 32nd Sienna convention that's going to come on here in Dallas in August. So if you're out there and you haven't registered for the convention, please go ahead and register. If for any reason you're not able to attend, your money will be refunded to you once you cancel your registration. And there's also an excursion to the Forward Science Museum and to the Bureau of where the dollars are printed. Okay, where money is printed here. There are only two locations in the United States: is Washington D.C. and Dallas. So if you want to see how the money or the currency that we use is printed, just come to Dallas and you have that opportunity. All right. So we'll go back to Doug. Welcome back, Doug. We have two questions. Mr. Lawrence Dagadu says, I have a problem understanding the difference between a benign polyp and a precancerous polyp. Please explain this for me.
Okay. So polyps are usually what can become or can transform into a colon cancer. There are the polyps, different types. We have what we call the villous type, and then the tubular types, and then the adenoma types. So the type of polyps, depending on what it is, based on the shape of the polyps, some polyps have high likelihood of becoming colon cancer, and some would not. The ones that would have very low tendency of becoming colon cancer are the ones that are referred to as the benign polyps. And so usually when we take the biopsy, when we take the polyp, we normally send it to the lab, and the pathologist will look at it under the microscope. There are some characteristics of the cell which we describe as dysplastic, meaning that they have high tendency to transform because there are layers of the transformation from normal cells to abnormal cells. If that dysplasia, which the term we use for the transformation, is very high within that cell, then we refer to those as precancerous cells because they are dysplastic. They don't look as, they are in between the normal cells and the cancer cells. So that transformation is what we call the precancerous. But if you have, you take a polyp, which is showing in the colon, and then you look at it and it's just looking similar to the normal cells, then we say those cells are benign. So that's the main difference between. So precancerous cells will be this plastic cell between the normal cells and then the cancer cells. So polyps can either be a benign or precancerous. Yeah, that's true.
Okay. And the second question says, what are the markers for colon cancer from your annual physical?
So if you have colon cancer, typically we don't, if you're just doing the screening, we don't check for cancer markers. We have the commonest will be what we call the CA markers, but we typically do not check for them unless we are under chemotherapy and we are using this as prognostic markers. We typically do not check for them during screening tests.
Okay. And then this question is from me. What is the difference between the colorectal and the colonoscopy screening?
So the colon, like remember when I was talking about the GI tract, I said we have the small intestines and then we have the large intestine. The large intestine goes all the way from the ascending, transverse, descending, and then the rectum. So the entire thing you can refer to as colorectal cancer, which is meaning that cancer in any of that location. Now, we have something we call a proctoscope, which proctoscope is a scope that you can use to just look inside the rectum and a small portion of what we call the sigmoid colon. The sigmoid, when you come to the descending, the small portion before you go to the descending is the sigmoid colon. So that area, you will only able to look inside the rectum and the sigmoid colon, but you don't go beyond that state, that proctoscope. So that's different. Like if somebody is bleeding and then, or you don't have a means of doing the entire colonoscopy, then you can do proctoscopy just to find out if that early portion is okay, especially if you don't have means of maybe doing some kind of sedation during colonoscopy. You don't have any means of doing that. You can do a simple proctoscopy just to find out that area. So colorectal cancer and colonoscopy are just terminologies. Colorectal cancer and it's a terminology, and colonoscopy is just the means of looking through the entire. So we can say proctoscopy, if you have colonoscopy, you don't even have to do proctoscopy at all, because it's the same process. You're going to go through the rectum, go to the sigmoid colon, go to the descending, transverse, and then the ascending colon.
Okay. So which is more effective? And I know there's another pre-screening too that you just ask to bring your stool.
That is the fecal occult blood test. So
okay, so which is more effective? Like, is it going through the screening or doing that?
So the stool, it's not effective at all. You just, because if there is no amount of bleeding coming from that cancer, then you have no idea that is happening. Now, some people use that, but the frequency of checking should be higher. So for instance, if I do one colonoscopy, I may not need colonoscopy for the next 5 to 10 years. But if I'm just using fecal occult blood test, then I have to be doing it yearly to make sure every year I'm checking so we offer those to people who say, oh, as for me, I'm not comfortable doing the prep, or I'm not comfortable somebody doing a colonoscopy on me. So you can offer that as an agent. So, okay, every year you bring your stool for us to be checking. If we see any small amount of blood in your stool, then we can now offer you the colonoscopy.
Okay.
So it's not, I would not advise anyone to do that. No. If you really want to know if you have high risks for that, because if you have polyps, for instance, you will not, the stool test will not pick up polyps. And polyp, like we said, can be benign and precancerous. So if they are precancerous, you want to take them out. And so that's why anytime they see polyp in your, during the colonoscopy, they just take it out, because unless there's a lot of it, if you have one or two, just take them out and go and check to see if they are precancerous or benign.
Okay. All right. At this point, we don't have any more questions. So if you can continue with the presentation, and if we have any questions, we'll go back to them. Thank you.
Yeah, so we talked about the treatment options that are available. We mentioned chemotherapy. We mentioned surgery, because we said surgery is the most important one. So now we're going to look at prognosis. Prognosis means that how do you tell whether I'm going to do well with the cancer diagnosis or not? Now, to go in detail about prognosis, you need to know what we call cancer staging. Colon cancer is staged into 4 stages. You have stage 1, and then you have stage 2, and you have stage 3, and then you have stage 4. Stage 4, of course, is the worst prognosis. Now, stage 1 simply means that the colon cancer is localized to the lining of the colon, and it hasn't spread beyond that. The details of that are really not necessary for this thing, but based on the further spreading within the layer of the colon, you have what we call a stage 2. And stage 3 limits spread the entire layer of the wall without spreading beyond the colon. Now, any spread of cancer cell beyond the colon, that is either in the lymph nodes or spread to any other organ or bone, then we refer to as stage 4. Stage 4 is the worst prognosis, like I said. In that case, for instance, if we do screening, and then we find out that or we do the staging, and you're in stage 4 already, which with a poor prognosis, the likelihood of us offering you surgery as a means of treatment will be very low, because the disease has already spread to other parts of the body. And so that is why it is very important to have the initial screening. Look for this when it's at early stage. So don't wait until you are 65 before you go and say, oh, I'm now coming for my colonoscopy. Do it after 55. Find out if you have your primary care provider. Find out from your primary care provider, hey, I'm 46 years old. When are you going to send me for colonoscopy? So they have to send you to go and have this colonoscopy done, because when we pick it early enough, then we will be able to take that portion of the colon away, and you will do well. So when you are stage 2, stage 3, sometimes you do well as well, but there are instances where you have spread to other organs that you can't pick up easily. Now, then stage 4, the only option in stage 4, which is the worst of all of the stages, is chemotherapy. And sometimes we use chemotherapy to help you navigate the whole process of the cancer experience. And so based on that, again, screening becomes very important. So we talked about colon cancer causes, screening, signs and symptoms, treatment, and prognosis. And I will end here. And if there are any other questions or any other contributions or experiences people want to bring on board, we are open to questions and open to contributions so that we can deliberate on. Thank you very much.
All right. Thank you so much, Doug. Thank you. That was very informative. At this point, we will take a quick commercial break, and then we'll come back. And then if there are no more questions, we'll just Doc will give us his final words. Okay. Mm-hmm. All right. Stay tuned.
Hey, David Sabina, it's been a while. How have you been? Have you heard about Sienna 2025 in Dallas? It's going to be the biggest event of the year.
Oh, Pastor Martin, so good to see you. I've heard some buzz about it, but tell me more. What makes it so exciting?
Oh, where do I even begin? It's a 4-day celebration filled with culture, networking, and unforgettable experiences. Plus, they've made registration super easy.
Really? How do I sign up?
It's so simple. Just go to www.sienna.org www.dallasaves.org. Again, www.dallasaves.org and pick your package. You can even add a $60 excursion to explore Dallas in style.
That sounds amazing. But what about hotel accommodations?
Oh, no worries. The convention registration is linked to the hotel reservation. When you register, just select if you need a hotel and the dates you will be staying.
Oh, that is so awesome. And I don't need 2 lanes?
Yes, you will get an email from the Sheraton DFW Hotel with your reservation details and a credit card authorization form to finalize it. And the best part, you won't be charged for your room until you check out.
Oh, this is really convenient. Anything else I should know?
Yes, as if the package wasn't already great, they just announced that everyone who registers now gets a complimentary buffet-style American breakfast at the hotel.
Oh, no way. That's such a great deal. I don't want to miss out. I'm registering right away before I forget.
That's the spirit. Let's lock in our spots and make Sienna 2025 unforgettable.
Welcome back. So we'll just take some quick announcements and then we will continue with the show. This is Sienna Media and TV. If this is your first time watching us, welcome. We have other shows that we run on this channel. On Fridays, DJ Mawanyega comes our way with the African jazz and traditional music panorama, and it shows every Friday, 8 p.m. Eastern Time. Or 7 p.m. Central Standard Time. So that's for Friday evening for your realization, okay? And then Saturday morning, we have the Health and Wellness Hub right here as you're watching us. So we are in the month of May and we're coming your way with a lot of stuff for our mother. We know in May, we celebrate our mothers. So we have something in line or some nice stuff coming up for our mothers. We've dubbed it our Mothers Month. So May is going to be, we're going to be celebrating our mothers. And then in June, we're going to be doing the same for our fathers. Yes. All right. And then after our Health and Wellness Hub comes on the Sienna Central Talk Show hosted by Empress Mausi and F.O. Steve. That will be right after our show, the Health and Wellness Hub. And then right after that, we have Dunenyo Bobobo coming your way, all the way in collaboration with Top Radio in Ghana. And Mama MFA hosts that show. That also comes your way. And then after that, we have Mr. Overgbe, where we learn our Ewe language. The other day, I was corrected. Ewe is not a dialect. Ewe is the language, very rich language. So if you want to learn more, if you want our children, especially our children in the diaspora, to learn our language, please tune in this afternoon. That'll be 4 p.m. Eastern Time or 3 p.m. Central Standard Time and 1 p.m. PT Time to learn our Ewe language. So that'll be about it for Saturday shows. And then Sunday, our sister Nicole comes our way with Africa Chill. Yes, where we also learn about, various stuff about our culture, our rich Ghanaian culture and our rich Ewe culture. So that is what we have for you. There are other programs that are in line that are going to be coming our way later on, and we will announce that. Okay. And so we all know Sienna is coming up. Our 32nd Sienna convention is coming up. Barely, we have less than 3 months. It's going to be at the end of August. So from August 28th to September 1st, Sienna is happening live here in Dallas. And Dallas is working hard to make your stay here very unforgettable. So this is what Dallas is putting up, this Cowboys and Cowgirl Night. Okay? So if you haven't gotten your cowgirl or cowboy attire in your head, please just get something, just something to identify you as a cowgirl or a cowboy. And if you haven't registered too, please go ahead and register. If you, for any reason, not able to attend, your money is going to be refunded to you as long as you cancel your registration. So it's better for you to register and not have any spot then register and know that if you're coming, you're well taken care of. Okay. And so we also have an excursion that is going to be as a package for the no, you have to select that as a separate package if you want to go to the excursion as well. And then yes, so the excursion is gonna the convention is gonna be from Thursday to Monday. It's pre-packed. If you've attended Sienna convention, you know what I'm talking about. So Dallas is getting ready for you. Don't miss out on this because you're gonna regret it when you hear people talking about the experience. So if you haven't registered, please go ahead and register. Thank you. That is for those are for the announcements. We'll go back to the studio. We still don't have any comments or any questions from anybody. So we'll go straight to Doug to give us his final remarks for today.
Okay, thank you very much. So I think when I started, I said one single thing, that if there is anything you can take from this, talk, is that make arrangement to go and have your colonoscopy done. And the risks of colon cancer gets higher after the age of 50. But remember, we talked about the precancerous cells that can happen. So that can happen way before 50. So after 45, that is when your screening starts. So the best form of screening is the colonoscopy. We have other forms that we talked about, like the stool or cord blood test. That is not very effective. You do it too frequently and you may miss a year or two, or you miss the opportunity because the time that you got a sample, there was no blood coming from the site of the cancer, and you were not able to pick it up. So the colonoscopy is the key thing that you need to do to reduce your risks of developing a poor prognostic stage of colon cancer, which could be a stage 4 where there's nothing for us to do. But if we pick it early in stage 1, we can take that portion of the colon away, and that can be a cure for you, where you'll be a good cancer survivor. So that is it for me, and it's been a great opportunity always to be on this show to talk about our health.
Thank you.
How we can help ourselves. Thank you very much.
All right. Thank you, Dr. Afenya. Thank you so much. We appreciate your time. You always take time off. We know you're busy, but you always take time off to come on here to the Health and Wellness Hub to educate us. Viewers, this is free consultation. When you go to the clinics and your doctors, the practices, you know how much you pay just for consultation. But this is free, and doctors have availed himself to help us understand a lot of stuff in our medical, situation. So thank you, Doctor. We don't want to take it for granted. We really appreciate
you. Thank you too. Thank you too for inviting.
Thank you, viewers. Thank you for watching. We've all too soon we've come to the end of another show, and it has been very informative. I've learned a lot, and that when I go back next time I go back to my doctor, there's some questions that I'm going to ask, and I hope you're also going to do the same. Thank you. Okay, that's the last question. Somebody just brought a last minute question where we only have 1 minute. Okay, it says, for someone listening now with colon cancer, are there resources and support groups information?
We, unlike when you are actually diagnosed with colon cancer, where there are support groups, the screening parts they don't really have support group, but there are a lot of support groups locally and international, even that have support group for colon cancer survivors, where if you have been diagnosed with colon cancer and you either had chemotherapy and now you are in remission, they have a large support group locally and then national or international as well.
Okay, so for the person who has the question, RW, so that is it. There are a lot of support groups out there. So just, I think she can Google it or ask from your medical
Right.
providers, right?
Yes.
Okay. All right. Thank you so much. Thank you for all our viewers. Thank you for all those who sent questions. Thank you for watching us. Please make time again with us next Saturday and stay healthy and let's love one another. All right. Until we see you again next week. Bye-bye for now.
Yes, KKG akakafo aroji orokogo afuwati agbama biesa anyanya ato jankle makara nanamchi manana nyakoi yenya ba ajikali ikala angama Flo's tasty treat anya ajikali ika azena azada shiada akutapeo asroda peo no nyeba na jigazandum nano bana ba first course Allo starter. Anya no indudu ika no nyaba na ajiba ya anopoma ya ma ajiba ya dum papi ya dakwa. To ko nyaba na ji Flo's tasty treat product ya nikanya ashitali. Ade ya ala nu goma. To ko nyaba na kwi. Na kwi de na se baba akwedama. O pro pado so pajio nyano adudum. Anu na mara shiada. Ji Flo's tasty treats. And you know so Katavana engagement, wedding, official fee can hear me a quagga alaba one of all. Airtime novinger, Jababa, Bohana grabber, one or show. No Jimla Mojide. Jabana attach the www.Flo's tasty treat. Yola 212-915-9331. Jagaba Naji Flo's tasty treat. Then I call Adara Wapadoma Nyanobutu. Flo's tasty treat. I like the Flo's tasty treat. I don't know I'm at the corner shadow. Flo's tasty treat. I like